Days after Ballad Health revealed plans for the creation of a comprehensive regional trauma and emergency care system, some Tri-Cities leaders say they don't agree with some of the changes. Again, good evening. I'm Josh Smith. Sarah Diamond has the night off. Last night, the Sullivan County Commission approved resolutions opposing the designation of Holston Valley and Bristol Regional Medical Centers as Level 3 trauma centers. Ballad Health said it will designate Johnson City Medical Center as its only Level 1 trauma center. That's the top tier in an effort to streamline and reduce duplication of services. Level 1, the top designation for trauma care. The Sullivan County Commission also passed resolutions opposing a plan to change children's care in Kingsport. Although Ballad Health announced plans to establish pediatric emergency rooms in both Kingsport and Bristol, the region's first pediatric trauma center will reside at the Niswonger Children's Hospital in Johnson City. Now, many of you reached out to News Channel 11 asking questions about the changes in children's trauma care services and what it's going to mean for you and your family. Caroline Corrigan's in your corner. She took your questions straight to Ballad Health leaders for answers. And Caroline, you also spoke with commissioners who passed those resolutions last night opposing Ballad's trauma plan.
Josh, I spoke to several Sullivan County commissioners today who told me they were frustrated after hearing about this announcement because they say they were never contacted by any Ballad Health leaders about any of these changes. On Thursday night, the Sullivan County Commission approved several resolutions opposing Ballad Health's recent announcement. At the center of those resolutions,
it's a disgrace that Ballad Health didn't reach out to us.
Commissioner Hunter Long, a longtime first responder at the Kingsport Life-Saving Crew. He says these changes are a concern.
If we lose Level 1 here in Holston Valley, even if we could become a Level 2 instead of a 3, that would overall be better for patient care inside Sullivan County. If we are a Level 3, which they stated we are going to become a Level 3 within some time, lives will be lost. I think the mortality rate will go up. I think the death will rise here inside Sullivan County.
Another concern, changes in children's health care, which means they're consolidating their neonatal intensive care units to Johnson City's Niswonger Children's Hospital.
I don't agree with it. I think it should stay here.
For mother Danielle Percival, it's a change she can't imagine. After giving birth to her son Grant at Holston Valley, he spent a week in intensive care.
That's a risky situation for my son to have gone all the way up there. I mean, that's a drive. Anything could have happened.
But Lisa Carter, CEO of Niswonger Children's Hospital, says this change would allow for more opportunities.
Combining all of these services and really standing up the Children's Hospital will afford us the opportunity to bring more subspecialties in.
And Ballad Health executives released a statement today saying, quote, our decision to focus all our Level 3 neonatal intensive care services at Niswonger Children's Hospital was based on evidence and recommendations from the American Academy of Pediatrics. And Josh, I reached out to Ballad Health leaders today to get a response regarding these resolutions in oppositions to the trauma center and the children's care services. And today, Ballad Health told us in part, quote, they were not asked for any information from the county commission, and further stated they believe commissioners did not have the benefit of accurate information in which to make their decision. Josh.